when you talk about routine medical checkups, these are checkups that are done not because the individual is actually sick, but just as a matter of being health conscious, as a matter of health consciousness, the individual goes to the doctor, goes to the clinic, goes to the approved laboratory to run some medical checks to be able to find out the state of affairs in his or her body. That's why it is called routine. So the individual is not sick. The individual is just taking a proactive step in that direction. Now, this becomes more important or most important when someone comes from a family that has certain disease conditions. So if you come from a family that has certain disease conditions running in that family, maybe it happened to the mother, maybe it happened to your father, maybe it happened to your uncle, maybe it happened to your brothers or your relatives in that family, it is obviously important at that point to begin early on to monitor yourself for such situations. And so I want to focus purely on three different conditions that are most common in our environment. When you talk about the likes of diabetes, when you talk about hypertension, when you talk about cancers, these are very common these days. They are claiming lives and they are also causing, health morbidities, as we call it. So that's why I want to just take time to look at these three conditions as far as the issues of medical checkup is concerned. And of course, we'll be touching some other areas. We're also going to be looking at the overall benefit of medical checkup at the end of the day. But let me start from diabetes, a disease that is very common in our society because diabetes, hypertension, certain cancers are hereditary. So we pass them on genetically from one generation to another. And because it's in the gene, it becomes something that is transferred from parents to children, and even on to children in that regard because it is in the gene of the family. Now, we have also known that even though these conditions are in the gene, there are things to do to keep them away from your own life. And that's why we're speaking about this at all today. So looking at diabetes, diabetes is a situation where the individual's blood sugar level is out of control. Okay? And because of that, the tissues of the body begins to have certain complications because the sugar in circulation is excessively high in that regard. I don't want to take you through the academics of type 1 and type 2 diabetes and all the types, but the truth of the matter is that oftentimes we're looking at the adult onset diabetes. Adult onset diabetes. That's the one that commonly runs in family, whereby the blood sugar after some time begins to rise in an individual that has the genetic disposition to the disease. Some women, when they are pregnant with baby, also have pregnancy-induced diabetes, where the blood sugar during pregnancy becomes out of control. So that also exists. But in the case of the adult, purely or adult onset diabetes, that is due to a familial inheritance, now this starts to manifest, usually at mid-age, midlife, 40s, 50s and above, the individual blood sugar begins to go out of control. What really happens? Biochemically, we discover that the ability of the body at that time to metabolize glucose becomes impaired. Either that the glucose that the pancreas either that the insulin that the pancreas is secreting is insufficient, or the insulin is just deficient in its activities. and therefore it loses ability to control the sugar level in the body. And so the individual ends up with high blood sugar in circulation. What are the things that somebody with diabetes, what are the things that you're likely going to notice? The individual may not notice anything for a considerable length of time, and that is why these disease conditions are not too good at all, because the person may not even have any symptom at the onset. But when things begin to go out of hand, the individual may notice that he or she is beginning to get thirsty very frequently, drink a lot of water, but in the same vein also passes a lot of urine per time. So you just discover that the quantity of urine you're passing has become excessive, all right? And then you also get very thirsty, dry mouth most of the time. Now that's a symptom or a sign of diabetes. Now you may also, as a person with diabetes, the individual may also discover that maybe you're losing weight and all that. Despite your eating well, you may be losing weight and all of that. You may also, I talked about urine earlier, you may also notice that when you pass urine, maybe especially not in the toilet, you pass urine in a place and then you come back after a while to look at that place where you passed urine earlier, you may see some ants gathering around the place. That means there is sugar in your urine and the ants are just there to feed on the sugar. So those are things you might notice. But like I started with, you may not notice anything. And that is why the place of routine medical checkup becomes very, very important. So when you know that you come from a family that has diabetes as one of the illnesses that run in that family, you need to start early on to check your blood sugar, regularly. And when I mean regularly, you could do this every 3 months, you could do this every 6 months, especially if things are still okay. But of course, if the individual has been diagnosed already with diabetes, you could even do the testing multiple times in a day, because the blood sugar rises as you eat different meals. Okay? So, with that in view, you need to, conduct medical checkups that are around diabetes. Now, I have not talked about the complications of diabetes, but I should, because out of the complications will then lead you also to some other tests that can be done routinely. Now, diabetes can affect the eyes, diabetes can affect the brain, diabetes can affect, the blood vessels, diabetes, even in some cases, can affect the heart, depending on the degree. But most worrisome is that diabetes can affect the kidneys. And when it begins to affect the kidneys, the individual, begins to have some elements of kidney failure, begins to pass glucose in urine, begins to pass protein in urine, begins to, have other features suggestive of poorly functioning kidneys. At that point, that diabetes has already become very complicated, all right, because there are now what we call comorbidities. And this is why it's important that when you go for routine medical checkup, deliberately we do blood tests, we do urine tests, we do all manner of other tests. We check the heart, we check the eyes, we check every part routinely, just to see if there are any changes that is traceable to any form of disease condition. So this is important, speaking about diabetes. Maybe now that I'm talking about diabetes, I should just finish up on it by saying that it's important that when the diagnosis of diabetes has been made, to brace up, and I want to use my word again, brace up to actually managing the situation, because it can be managed. It can be controlled. What we are talking about is excessive blood sugar in circulation, the amount of sugar in circulation. In today's treatment plan for diabetes, we no longer emphasize don't eat this, don't eat that, don't eat carbohydrate, don't eat that one, don't drink this or don't drink that. Why that is important is no longer our emphasis. Our emphasis today has become what do you really eat and the quantity at which, the quantity of food that you're eating per time. So we are now educating people to say that even if you want to eat pounded yam, you want to eat amala, you want to eat akpu, you want to eat eba, because these are the common things we eat in our society, in our environment, you can still eat them, but the quantity has to be minimal per time. Somebody managing diabetes also is not likely somebody to do 3 square meals. Because you're going to be eating small quantities per time, you are actually allowed to eat multiple times, more than 4 or 5 times in a day, but the quantity has to be small. Why are we using this approach? We're using this approach so you do not load the system with a lot of sugar per time, and the system struggles to metabolize that sugar. So when you eat little per time, the insulin in the circulation is just enough to deal with that small food that you are eating per time. And after a short time, the stomach begins to adjust. So the teaching today is that anything you want to eat, make a feast and put the size of your feast on a plate. That should be the size of meal that you should eat per time as somebody with diabetes. Your own feast, not your doctor's feast, not your mother's feast, not anybody's feast, your own. The size of your feast, put it on the plate and use that as the control to measure the quantity of food that you eat per time. Because it's important to moderate the blood sugar by controlling the amount of food you eat. Now, don't say because, it is beans I'm eating, it is protein I'm eating, therefore you eat it in excessive quantity. At the end of the day, everything gets converted somewhere, somehow, to glucose for the body to utilize it. So don't overdo it because you feel that I'm not eating carbohydrate, I'm eating protein. Even at that point, excessive intake of protein can also be bad for your kidneys. So it is important to achieve moderation. Now, sometimes you may start off also with controlling with certain what we call hypoglycemic drugs that lower blood sugar. Now, if your doctor has made those prescriptions, please note that you are not treating malaria, that you treat for 3 days and then you are well and that's the end of story. When you're treating diabetes, it is a lifelong situation. Therefore, be prepared to take your treatment seriously, very seriously. I mentioned about factors that can lead to these issues around excessive blood sugar in circulation, and I talked about in family inheritance. Yes, that's one. But some people on certain drugs, those drugs can end up causing elevated blood sugar for them, secondary diabetes for them. Some people that are overweight, obesity also will lead to poor sugar control. Even if they have the tendency, from the family line, obesity will make the diabetes to come earlier than normal. So it's important to control your weight, moderate your weight, control, your body mass index, exercise, also very important in managing diabetes. Diabetes can have very serious complications. You don't want to have complications of diabetes. Nobody wishes the complications of diabetes, not even on your worst enemy. And that's why it is important to deal with it early on, because from the brain, diabetes can cause stroke. Poorly controlled diabetes can lead to stroke, and we all know what stroke means. So poorly controlled diabetes can affect the heart and blood vessels, like I said earlier. Over time, also, diabetic complications can lead to, cancer of the pancreas due to, diabetic complications. So these are things that can occur, and therefore you need to manage them. Some people have had their, feet or foot amputated because of diabetes. If somebody with high blood sugar rather, diabetes, ends up having an injury, that injury takes time to heal. And because the injury takes time to heal, sometimes it doesn't even heal at all. And so people with diabetes, when they have what we call diabetic foot, if it refuses to heal, because we don't want the person to die from the infection in that leg, we end up cutting the leg. And so it is important that we control diabetes before it gets out of hand to the point of causing complications. Again, that brings us to the benefit of routine medical checkup. Routine medical checkup will get you to know there is what we call the pre-diabetic condition. So there's a test we do called the HbA1c, glycated hemoglobin test. When you do that test, it tells you how your body has been controlling your sugar in the last 3 months. So it's a test that checks how your system has been handling your sugar for a whole period of 3 months. And if somebody is pre-diabetic and all of that, it will show you based on the range you are getting. So you begin to take caution, right on time. So routine medical checkup is very important dealing with this condition of diabetes. Because time is running, let me go quickly to hypertension, another disease that may not give you any sign, may not give you any symptom. You may just be living your life without knowing that there is hypertension, and that's why we are talking about it. That's why we want people to routinely do medical checkup for these things. Now, hypertension is a sustained elevation of your blood pressure. When somebody has sustained elevation of the blood pressure, we say that that person has hypertension. Hypertension, sustained elevation. What is the normal blood pressure? Now, blood pressure can actually be calibrated based on age. Okay, so a blood pressure that will be normal for somebody 20, 30, is just normal for that person. Now, somebody 40, 50, 60 may have a slightly elevated blood pressure that is higher than when you were 20 and 30. Of course, as one advances in age, beyond 60, 70, there might still be a little more elevation, but there is a cutoff. So for every age bracket, there is a cutoff. So when you're beginning to have blood pressure elevation, sustained elevation that is above normal for your age bracket, your doctor will tell you. Now, one of the things we see commonly is that the individual who is now having this high blood pressure will tell you, oh, it's because I didn't sleep well yesterday. Oh, in fact, I've been going through a lot of stress. Oh, we give excuses. Bottom line, people want to tell you the reason why their blood pressure is high. But no matter how good your reason is, if blood pressure wants to cause catastrophe, it does not take your permission. And that's why you must deliberately check. And don't be in denial. If it's there, how do we manage it? If there's sustained elevation of the blood pressure, okay, how do we manage it? For a younger person, you're looking at 120/80, 120/70. Between the systolic and the diastolic pressure, you're looking at even 110/60. All those are fine for a younger person. As the individual is going to 40 and 50, you're going to be looking at 130, 80, 85, sometimes even up to 90. But if it doesn't exceed 90, then we are fine. Now, when the individual is getting up to 60, 70, you're going to be looking at blood pressure, sometimes up to 150, 95, 100, dancing around there. But even at that, you need to then begin to possibly take action so that it doesn't go above that. Because just like diabetes, hypertension has its own complications as well, which I will talk about shortly. So when there is sustained elevation of blood pressure, the individual needs to know and needs to take treatment. When I kept using the word sustained, it means that we don't take one reading of blood pressure and then immediately begin to treat the person for hypertension, except depending on the level. So if I measure the blood pressure of an individual and it's 150/100, and this is the first time he's ever recording something like that, I want to do it again at a different time, especially waking up early in the morning before you start the rigorous day's activities. Let's check again. But if I'm getting a blood pressure of 220/110, 200/120, you are already a medical emergency. In fact, the law says if I allow you to go, then I'm not a good doctor, because that individual can easily end up with a stroke at any moment. That pressure is already on the high side. So that person, even though it's the first recording, must be attended to immediately to avoid a medical catastrophe. So how do you know that you have high blood pressure? Simple. Routine checkup of your BP. You know, you are in a pharmacy, you are in a clinic, just ask the nurse, just ask the doctor, whoever is there, please check my blood pressure, and with that you will know your level. Some people have even gone to the point of buying these kits, the kits to check for blood sugar, the kits to check for the blood pressure in their homes. They just do it because you can buy these things and then use it in your own home to check yourself, especially if there is a family history. As I mentioned earlier, hypertension is also part of the disease conditions that can be inherited from parents to the children. And we have seen people manifesting high blood pressure even from the age of 22, 23. I mean, just because that condition exists in either one or both of the parents. So once the parents have it, you should be on the watch out, and that's why routinely you do those tests. For hypertension, you also want to check your blood pressure, your heart, you want to check your kidneys, you want to check your lipids. As you go to the hospital, they list out the tests that you should do. And what we have noticed is that these issues around diabetes and hypertension, they often now go hand in hand like brothers and sisters. They often go hand in hand. If you find one, likely you're going to find the second one. So we routinely investigate for these conditions just to be sure that the individual is free from them. These two conditions, diabetes and hypertension, has led to the massive amount of kidney failures we're experiencing in the society, kidney damage, to the extent that people are now, some people whose kidneys have been damaged by blood pressure or by high blood sugar, diabetes, have ended up with either kidney transplant or they are presently on dialysis. So these are things that we must take care of. Complications of hypertension, much like the complications of diabetes, hypertension can cause stroke, hypertension can weaken the heart, hypertension can also affect the eyes, hypertension can affect blood vessels and the likes. So it makes the blood vessels to sometimes become more rigid, and we have also had people go through amputation of their leg because the cardiovascular damages that comes from these things have ended up affecting the blood circulation, and some people have ended up losing their limb because of complications of high blood pressure. So it's important that we take note of these conditions, make routine checkup for them, and then free yourself up from those conditions. There are drugs to treat hypertension. There are lifestyle modifications to manage hypertension, just the way you also do lifestyle modification to manage diabetes. Hypertension in particular, how do you even do some self-measures? If the individual is also overweight, that person needs to trim down because overweight can lead to hypertension. Some people deliberately eat a lot of salt. That needs to be cut off. We have seen situations where just by eliminating salt and Maggi from the diet, the individual has gone free, completely free from hypertension, no more requirement to take drugs. So it's important that if you are somebody that is used to taking high salt content in your meals, cut it off. If you come from a family that suffers from hypertension, begin to address that situation early on, and you might just notice that you won't end up with blood pressure issues. So dietary control like that is helpful. Control your intake of fatty foods, food with fats and oil that can end up increasing your level of lipids. And when your level of lipids are increased, they tend to clog the blood vessels, and when that happens, it leads to sustained elevation in blood pressure. Hypertension is real. It can be managed. It is something that if it's there, people have controlled it efficiently. You can monitor for it. That's why we advocate for routine medical checkups, so that if you come from families that have certain disease conditions, please early on begin to check yourself for those conditions, especially from the ages 30, 40 and above. And like I mentioned earlier, for instance, we have seen people from their early 20s manifesting high blood pressure already because it exists in the family. So as often as we have opportunity to check, it is good to check. Lastly, among the three disease conditions that I want to speak to this day is cancers, because cancers can also be inherited, can be hereditary. Cancers can also be inherited, all right? So there are certain types of cancers that run in families. Breast cancer is one of such cancers that run in families. And this is common, so you want to check for them. There are cancers that come as a result of certain type of infection, especially the cervical cancer in women, which is now commonly known to be due to the human papilloma virus. Okay, so some cancers run genetically in families, and therefore, if somebody has comes from a family where maybe one or both parents have suffered issues of cancer, it is important that that individual pays attention to making regular checkup even before any such thing manifests in your life, so that you can take precaution early on. Let's look at the cancer of the breast, for instance. There are tests that are done, especially what we call mammogram for people from age 40 and above. You want to do your mammogram once in 2 years at the least. But unfortunately, while we are advocating for mammogram at age 40 and above, sadly, we are seeing breast cancers even before age 30. Not too long ago, I saw a young lady who was already, on the treatment pathway for cancer of the breast. She's not even a married young lady. I think about 27 or 29, one of those two ages, about either 27 or 29, and yet already with breast cancer. So, so while we advocate that you do mammogram because the results are better from age 40 and above, when when the glandular tissues in the breast are a bit more reduced, but even at that, these diseases can manifest much earlier. So if there is a particular cancer that has happened in the family, it's important to check for such early on, routinely. Don't wait for the symptoms to happen before you start to check. So people do breast ultrasound to check for any growth. People do mammogram to check for any growth. You also can be taught how to do self-breast examination to locate any lump. If there's any lump, any swelling, anything in the breast that is like feeling strong there, that is something that you might want to show to your doctor, so that the necessary tests can be done to see if it is an early onset of cancer. Let me say, because I'm talking about breast cancer, a lot of women get worried when they have pain in their breast. Breast cancer does not start with the manifestation of pain. Pain is not, in fact, if you go to a breast clinic, more than 95% of the complaint that women come to the breast clinic with is the complaint of pain. And usually, oftentimes, it's just due to hormonal changes in their system that leads to those painful breast situation. Some also, because they wear tight bras, they have breast pain. If a cancer is in the breast, it comes usually with a growth, a mass. That is when it becomes noticeable. But sometimes you can dictate by doing those routine tests, it can be dictated even before it becomes a noticeable mass. But it doesn't start with pain. So pain is not what should make you afraid, and all that. It's just good to do the routine checkups, all right? And if you notice any lump, any solid, any growth that is completely abnormal, then let your doctor check it and do the necessary test about it. Breast can feel lumpy in certain period of the menstrual cycle, can feel irregular, lumpy. Just if you are not sure, let your doctor examine you personally to know if there is anything that is brewing there. So these are three disease conditions. Like I said, I'm focusing on them because they can be hereditary, so we must pay attention. Cancers can be hereditary. Now in men, one of the conditions that we also see from 40, 50s and above, especially from 50s and above, is the issues around enlargement of the prostate. Some of them become cancerous, some of them are ordinary enlargement of the prostate. There are routine tests to do. There is a test we call the prostatic specific antigen, PSA, for instance, that if a man has breast cancer, it will begin to rise. Even though it is not only breast cancer that causes the rise in PSA, but that is one of the markers that we use to monitor the possibility of prostate cancer. So it is important to do that routine test from age 40, 45 and above. Just do it routinely every 6 months to check the PSA and be sure that it's in order. If it is elevated, we don't start running helter-skelter immediately. We offer some treatment because infection of the prostate can also lead to elevation of the PSA. In fact, rigorous exercise can also lead to elevation of PSA. So we don't start running helter-skelter immediately, but we check for these other things. We treat for infection, and then the person repeats the PSA after the treatment. Most times, if it's due to infection, the PSA will come down. But if it's due to cancer, the PSA will continue to rise. And if it is in that situation, we go on to do what we call biopsy, take the sample for histology to determine if there are actually cancer cells there, yes or no, so that the appropriate treatment can take place. It's better always to treat early to avoid complications. All these conditions I'm mentioning, they can be treated, they can be handled, they can be put under check with early treatment. The challenge with not treating early is that by the time the individual is treating, you are not only treating the main condition, you are now treating with the complications as well. So at that point, you are not only treating the primary disease, you are now treating the secondary issues that are occurring due to the primary disease. And that's why we ask for people to routinely do medical checkup, for early detection of disease conditions. So in rounding up, I want to just run through the benefits of routine medical checkup. General benefits. So whether it is, no matter the type of disease you're, trying to screen for, there are just general benefits. Detection of disease is one of them. Early detection, because when diseases are detected early, the treatment is also less expensive at that time. You also reduce the risk of complications when the disease is detected early. So early detection is very important because it leads to early treatment, it leads to reduced cost of treatment, helps to protect the individual from the full-blown outlook of the disease itself. The individual is able to live a healthier life, just by detecting the condition early and treating it early. It eliminates the possibility of the disease spreading to other organs, and all of that. It enables the person to take prompt action. All right. So, on the whole, it saves you money to detect a disease early. It saves you the future risk, of more terrible things happening to you because the primary disease has been detected early. It saves you useful, lives ahead. Because when somebody maybe out of diabetes or hypertension ends up with a stroke, and if that stroke is such that the individual has lost the use of hand, the use of leg, or the ability to speak well, you discover that the quality of life of that person going forward is completely diminished. In fact, if care is not taken, the individual becomes a liability to those around him or her. Your useful life becomes over in a twinkle of an eye. So we need to, monitor these conditions, do preventive medical checkups, routine medical checkups, do your lifestyle modification. Before now, they say, being big in size and being heavy in size is an evidence of good living. But I can tell you, we know better. It is not any evidence of good living. It's actually an evidence of bad living. It's evidence of indiscipline, if you ask me, in the way that you conduct yourself. Forgive my being critical about that, because we see a lot of these challenges and we know some of them are completely preventable. And so let's watch for these things, do the medical checkups as often as you are able to, once in 6 months, once in a year, but especially if you come from a family that suffer from a certain type of disease condition, even if you are not checking for every other thing, ensure that you do routine checkups on this particular issue so that you can save yourself and free yourself from future harm and future complications and give yourself a better life expectancy. I don't create problems for your family. Don't create problems for people around you, because some of the things are preventable. It takes you being just disciplined on your own to do the right thing per time, check the things that you need to check, and then stay away from the things you need to stay away from, and have a healthy life to live.